Hello lovely people, I welcome you once again to my channel. This is your girl Nurse Abena, a registered psychiatric nurse in Ireland, but hey, I'm a proud Kenyan. So in today's video, I am going to tackle one of the Osce stations for overseas nurses. So if you're a registered nurse or a registered psychiatric nurse coming into Ireland to take the Osce, then this video is for you. You just have to stay glued to me and subscribe, like, comment, and share. If this video will interest you, then hey, you need to stay with me right now. Are you interested? Let's get started. Today is your first time coming across my channel. I welcome you, but please, have you subscribed? If you haven't, please do so for me. Thank you so much for doing that for me, and keep sharing for others to also join and get the right information to assist and guide them in their relocation to the Republic of Ireland as overseas nurses. But let me just put this across that whatever I'm going to say about this Osce, it doesn't mean I work with the Rcsi. No, whatever I'm going to share is based on my personal experience as a past candidate. So I'm going to attach the website, the preparation website, to the description of this video. So after watching, you can equally visit the website and get all the necessary documents and all the necessary information about this station. Is that just as I said that today I'm going to take you through the ISBAR station. The little knowledge and understanding I have about this station is what I'm going to share with you, but I believe it's going to help someone in his or her preparation towards the Rcsi. So the first thing you need to understand is ISBAR is actually a communication tool that is used between the health professionals to communicate or give updates about the patient's clinical status, whether or not the patient requires immediate review or not. Like, basically that is the concept of ISBAR. So before you enter that station, make sure that, just understand that you are going to exhibit your communication skills in those station. However, there is a form that you need to fill before you communicate. So just bear in mind that you're going to spend 10 minutes in this station. Therefore, whatever you write and whatever you're going to communicate should be very snappy and straight to the point. You don't have to go and beat about the bush. And remember that every information that you need to use to fill the form and communicate to the doctor is all written in the scenario. Therefore, you don't have to hustle yourself. Just go straight into the scenario and pick the relevant information to fill the form and communicate. Remember that the communication can be face to face with you and the doctor or the psychiatrist, or it can be done on phone. Whichever way the assessor will ask you to do, you need to follow the instructions. It's not difficult. You can also do it. So all you need to do about this ISBAR station is to go systematically according to the letters. It's just an acronym, ISBAR. So it's an acronym that you need to go systematically. So the I represents identity. So whose identity are you going to find? So immediately you make the call, you need to find out if it's exactly the doctor or the psychiatrist you are looking for. So identify the doctor. So in the scenario, the doctor's name has been given. So if it's Dr. Smith, go straight. Am I speaking to Dr. Smith? Just so he confirms. Then you move to identify the patient's name to the doctor. If the patient's name in the scenario is probably Murphy, just go straight. All right, Dr. Smith, I'm calling on behalf of my patient Murphy. Okay, so now the next thing you have to do is to confirm the ward in which you're calling from. If it's the psychiatric acute unit, if it's in the rehab unit, if it's the accident and emergency unit, whichever unit, that it will all be stated in the scenario. So just pick all this information from there, and then the last thing you need to identify is your name. This is Nurse Abena on duty. You are done with the I. So these are the basic information to bring out when you are talking about the I, and all this information is on the form. So after filling and picking the relevant information from the scenario to fill the form, when you are communicating, just go straight to the point as outlined on the form. I hope this is clarified. So from I, you move to S, and S represents situation. So this is the part where you communicate to the doctor why you want to see him. So basically with the situation, you communicate the changes in the patient's clinical status. So here you compare the current status to the previous status, and there is always a time frame that will be indicated in the scenario. It could be in 10 minutes ago or 15 minutes ago the patient's vital signs was like this, but currently it is like this. Or maybe 15 minutes ago the patient GCS score was this, but now it's this. So this comes in, so you are just going to communicate the current changes in the patient's clinical status, either being his vital signs or his neurological signs. You need to communicate that present against the previous. That's all you need to understand about the situation. So you pick the relevant information from the scenario to fill the situation part on the forms, so you can be able to communicate systematically. I hope this is also clarified. So from S, we move to B, which is the background. So it's basically requesting for a little background information about those patients that you are communicating about to the doctor. So just pick the relevant information from the scenario. It's basically just get the patient's name, why was he admitted and when was he admitted, was there any medical prescriptions given to him, is the patient on any IV fluids or NG tube. These are the basic information, and everything is on the forms, so you don't have to stress yourself. Look on the form, look into the scenario, and fish all those information onto the forms and fill it and communicate. So from B, you move to A, which is assessment. And this is where you tell the doctor what you think is wrong with the patient as a nurse. Yes, you confirm that there is a deterioration in the patient's clinical status. However, it is advisable that you do not make a conclusive judgment with your assessment. So it is always advisable to say that, based on my assessment, I think that the patient's condition is blah 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 blah. It saves you from further questions. You are not making a conclusive judgment. However, you are only making an assessment. You are only saying something that you think may be wrong with the patient based on your assessment, and you are not making a conclusive judgment of what is wrong with the patient. So the assessment, we move to the last letter, which is R, which represents recommendation. So what exactly are you going to do here? There are 3 things you need to know in your recommendation, and that is you letting the doctor know the time frame for which he has to come and review the patient. Is he supposed to come immediately? Is he to come in the next 5 minutes, 10 minutes, 15 minutes or so? You have to be specific with the time frame and give that to the doctor to come and review the patient. And you also need to buttress your reason why you want the doctor or the psychiatrist to come and review the patient within this time frame that you are giving him. So the best way to make a good recommendation is to go back to your INEWS escalation protocol as well as your GCS management protocol. You need to know those protocols to be able to know whether the symptoms of this patient requires immediate review. Without knowing the INEWS escalation protocols and the GCS escalation protocol, it will be very difficult for you to come up with a time frame in relation to the deteriorating state of the patient. So you know the deterioration status, compare it with the INEWS escalation protocols to be able to identify the time frame that the doctor needs to come and review the patient. You don't have to be worried about these INEWS escalation protocols and all that. Just visit the preparation website. I'm going to attach the link to the description of this video. So make time, visit the website and get all these documents. Know how the escalation protocol, the content of it, when to escalate and when not to escalate. You need to have these on your fingertips if you are coming to be an Irish nurse. So just visit the website and get all this information so that you'll be able to make accurate recommendation in your ISBAR station. And the last thing you have to conclude with is to ask the doctor if there is anything he would want you to do for the patient whilst you are waiting for him. Don't forget to ask this. It's very important. Don't forget to end your ISBAR station with this. Doctor, is there anything you would like me to do for the patient whilst I'm waiting for you? He will give you instructions. If the instructions has to do with prescription, if he's actually asking you to give medication to the patient, immediately interrupt. Tell him that you are inviting your colleague to confirm to the prescription he's giving you. Do not accept the prescriptions over phone all by yourself. Let a colleague be there to confirm. Just dramatize it. It's an exam. So just tell him, okay, doctor, let me call in my colleague to confirm the prescription. It ends there. And you are good to go. The final thing you have to do in your ISBAR station is documentation. In fact, documentation is one of the keys to passing Rcsi. Do not forget to do documentation in any of the stations that you enter. So in the ISBAR station, you document in the nurse's notes that will be given to you, right? Indicating the date and time and what you actually communicated to the doctor. Make sure you state the time the doctor agreed to come and review the patient. All those information must be in your documentation. And then finally, you sign with your name. And that brings you to the end of your ISBAR station and you walk out with full of smiles. I wish any overseas nurse preparing for his or her Rcsi, I wish you all the best. It is doable. Just prepare and prepare well for the exams. I'll make time some other day and take you through another station. Until then, please subscribe, like, comment, and share. See you some other time. Bye-bye.